According to the Occupational Safety and Health Administration, back injuries are a leading workplace safety issue in the United States. Back injuries are painful, often lead to long-term disability, and can be expensive and difficult to diagnose and treat. As a care provider, you are at risk of injuring your back while working. Daily activities such as bed making, assisting with ambulation, and assisting residents to transfer to and from wheelchairs, for example, place caregivers at risk of injuring their back. The good news is there are relatively easy steps you can take to protect your back at work. During this video, we'll teach you more about your back, the causes of back pain and injury, and steps you can take to protect your back while lifting and while assisting residents in your care. Your back is a complex unit made up of several components, including muscles, bones, and spinal discs. The spine is made of many small bones called vertebrae that are separated by discs. The bones of your spine give your back strength, while the jelly-like discs help to absorb the pressure and shock applied to your back during normal movement and lifting. These discs experience a lot of wear and tear, and if they are damaged, they may have to be removed and the remaining bones fused together. But proper posture and lifting techniques can help to evenly distribute the pressure on your spine and discs, preventing injury. Your back is also made up of ligaments that help hold the bones in place and support your back. Although ligaments are designed to stretch, if you stretch them too far, they can tear. They will heal over time, but the pain and healing process is unnecessary. You can help prevent ligament damage by keeping your back fit. Exercise regularly and don't overstretch. There are several factors that can cause back pain and injury. The first is poor posture. Standing, sitting, or lying down incorrectly puts unnecessary strain on your spine. Keeping your spine in its natural S-shaped curvature is important to long-term back health. Another cause is poor lifting technique. Improper technique when lifting, such as not using your legs, can place additional stress on the back and cause pain or injury. Additionally, working in an awkward position or lifting incorrectly over a period of time can lead to what's known as cumulative trauma disorder, which contributes to serious long-term back injuries. Another factor is being out of shape. If your back muscles are weak or if you are overweight, it puts additional strain on your back. The back can also be injured through impact trauma. Being in an accident, such as a car accident or a fall, can cause injury and back pain. Finally, another factor is aging and disease. As we age, the muscles in our back can become weaker, and age-related disorders such as osteoarthritis can also cause back pain. Here are some basic tips and suggestions to follow whenever you're lifting an object in the workplace. First and foremost, never lift anything unless you are confident you can do so safely. Never be embarrassed to ask for help. Use mechanical means whenever possible, such as a hand truck, a cart, or in large warehouses, even a forklift. Before lifting, size up the load. Ask yourself, how heavy is it? Is it an odd shape? Consider those factors when you decide if you'll be able to lift the object safely. You should also consider how far you'll have to move the object. Needless to say, the further the distance, the more likely you'll want to seek assistance. Is the area where you'll be moving about clear and safe? Are there doors that are going to be in your way? You should also consider if you'll be able to see over the load while walking. You never want to attempt to carry something that would obstruct your vision and potentially lead to a fall or other injury. Is it possible to divide the load into smaller pieces and take multiple trips? Don't be in a hurry. If you can carry something more safely by taking it in several trips, do so. When lifting the load, use gloves to improve your grip and protect your hands. Be sure to keep your back in proper alignment. Never use your back to lift. Always lift with your legs. Stand close to the object, center your body weight over your feet, and squat by bending at the knees. Now grasp the load securely with your hands and pull the load close to you. In one smooth motion, lift the object straight up. Again, use your legs to lift, not your back, and don't twist at any point in time. While carrying the load, again, keep your back in proper alignment the entire time. Walk slowly and surely, and use your feet to change directions. Again, don't twist your back. Do not lean over, and do not lift a heavy load over your head. Finally, if you become tired or fatigued, take a break. Carefully set the object down and take a short rest period before continuing. When setting the object down, position yourself where the load should go. Squat down by bending at the knees, and again, don't bend at the back and don't twist your back. Keep your head up to maintain good posture, and don't release your grip until the load is secure. All of the basic lifting principles and techniques apply when assisting a resident to transfer or ambulate, but there are some additional factors to consider. Starting with the use of mechanical assistive devices. When assisting a resident with transfer or ambulation, you want to consider the use of a gait belt. This is a special belt that fits snugly around the resident's waist and can be grasped by the caregiver during transfer or ambulation. Some communities may use a Hoyer lift. This is a hydraulic lift with a metal frame and a heavy canvas swing. The lift is capable of suspending a resident during transfer. A draw sheet is a regular flat sheet placed under a resident in bed that can be used to assist during transfer and repositioning in bed. If a resident has a walker, wheelchair, cane, or other ambulatory device prescribed for their use, be sure they use it appropriately. If the resident has a mechanical bed, raise it to a comfortable working height, usually about waist level, before assisting the resident. However, don't forget to lower the bed back to a safe height for the resident when you're done with your transfer or repositioning. It sounds simple, but make sure that both you and your resident have on appropriate non-skid footwear. Good footing is critical to prevent slipping and falls. Be sure to follow your state regulations, workplace policies, and physician instructions before using any mechanical device during resident transfer, repositioning, or ambulation. Additionally, be sure you've received specialized training in using the specific devices available in your workplace. When assisting a resident to transfer, just like when lifting boxes or other heavy objects, be sure to bend at your knees and use your legs to lift. You should be assisting the resident. If they are unable to participate in the transfer, you may need to have assistance from another caregiver or a mechanical device, such as a Hoyer lift. Be careful to avoid twisting your back during pivots, such as going from a chair to a wheelchair. Remember to move your feet as you assist the resident. When assisting a resident to ambulate, use a gait belt if appropriate and if available. If the resident has a weaker side, you'll want to stand on that side. Monitor the resident as you walk. If they become dizzy or unsteady, assist them to sit in the nearest chair. If a resident begins to fall while providing assistance, do not try to hold her up. Brace the resident against your body and gently guide her to the floor as safely as possible. You may need to go all the way to the floor with her to protect both the resident and yourself. Attempting to hold up a resident who has started to fall is more likely to lead to an injury to the resident and an injury to yourself, most likely a back injury. Your back is important. Follow the steps outlined in this video, as well as your own workplace policies to protect it and keep it healthy. Much success to you in following these important back safety practices in your workplace.